What is lupus? Maybe you've heard the word and you've been wondering what exactly the condition is. Maybe you have a family member or a friend that has lupus and you've been wondering, or maybe you have lupus yourself. Lupus is a condition, as a family doctor, by the way, I have a number of patients who have lupus. I've diagnosed it a number of times over the years, and it's one of those conditions that sometimes can be a bit tricky because it can literally affect any and every organ in the body. So we're going to talk about today what lupus is and what it's not. Again, these videos, and this video in particular, is not to make you think that you might have lupus if you have some of these symptoms, but it's to underscore the importance of getting checked out by your doctor to make sure you know what is and what is not going on with your body. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician, an on-air health expert and video creator. Lupus. Let's start with what it is. Lupus is an autoimmune condition. It's an autoimmune disease. You say autoimmune. What does this mean? I've heard that word. Autoimmune means it's a condition where the body actually literally attacks itself. That's right. The body, it's like it turns on itself. The body attacks its own tissues and cells by mistake. Now, lupus is not the only autoimmune disease. There are plenty others, but it is an example of an autoimmune disease. And as I mentioned before, lupus can literally affect almost any and every part of the body, which sometimes is what makes it a little tricky. Now, first thing you should know is that there are different types of lupus, not just one type. There's SLE lupus. That's probably the most common type. It can be mild or severe. It can affect many different parts of the body. There's also discoid lupus, however. There's also subacute cutaneous lupus, drug-induced lupus. That means lupus that's caused by medications. Also neonatal lupus, which is exactly what it sounds. It's rare, but it's a type of lupus that affects newborns. We're just going to talk about lupus broadly, okay? But understand that there are different types. And with the different types comes different symptoms. Now, a lot of people will ask, well, why does lupus even happen? Like, why did I get lupus? Why do I have this? Why does it happen? Well, to be honest with you, the cause is not entirely known. We don't exactly know why lupus happens. However, we do know that there are certain people that are at higher risk for lupus than other people. So risk factors, guys, this is important. Anyone can get lupus, but women are at higher risk than men. Very important. Also, African Americans, guys, listen up. Lupus is 2 to 3 times more common in African American women than in white women. And by the way, to this point, actually, most of the patients I have with lupus, and has always been this way, are mostly African-American women. Obviously, lupus does not only happen in African-American women, but understand that that's a risk factor. Lupus is also more common in Hispanic, Asian, and Native American women. And then African-American and Hispanic women are more likely to have severe forms of lupus. This is the thing too, autoimmune conditions sometimes travel in packs. So sometimes people with lupus may have other autoimmune diseases and vice versa. But let's get down to the symptoms. And this is what I was saying, that lupus can really literally cover the gamut in terms of what the symptoms are. They can be wide-ranging, and you guys have seen some of my videos. I've done videos on hypothyroidism, other conditions, and like, for example, with hypothyroidism, by the way, the most common cause of hypothyroidism, Hashimoto's disease, is an autoimmune condition as well. But with that, and from that video as an example, there can be so many different symptoms of hypothyroidism or underactive thyroid. The same thing can exist with lupus. So let's go through some of the symptoms that we sometimes see, that I have certainly seen with my patients and still do. I'm going to start with the things that I have most commonly seen with my patients. Pain or swelling in the joints. Huge with many of my lupus patients. Also muscle pains, okay? Like soreness, pains, difficulty with the joints. And as I mentioned before, pain or swelling. Also, rash. There is a characteristic rash to lupus that we call the butterfly rash. Like, this is my fingers for the butterfly, and it kind of sits right here. Obviously, it's not as big as a whole face, but a butterfly rash that literally can go across this area of the face. That is a very sort of characteristic rash that we're always sort of out on the lookout for. Fever with unknown cause. Hair loss. I've had a number of lupus patients that I've diagnosed, and their presenting symptom, they came to me with patches of hair loss in their scalp. And the workup for that revealed that they actually had lupus. That is one. Also, let's see here, feeling very, very tired. That's also a symptom that I've seen. I'm going to mention a few other symptoms that can happen with lupus. Chest pain with taking a deep breath, like just feeling soreness and pain when taking a deep breath. Changes in colors in fingers and toes. Sensitivity to the sun, rashes or skin changes with being in the sun. Mouth ulcers, even swollen glands. Now, not everybody with lupus has all those symptoms, okay? And remember, everybody with lupus is different from the next person, right? Lupus is an individualized condition, just like so many other things. So if you have lupus out there, I know you know this, your symptoms may be different from the next person you know with lupus or a family member or what have you. Also, it's important to know that symptoms may come and go. Oftentimes, patients will have what we call a lupus flare or flare-up. That's when symptoms are sort of heightened, they are worsened, and they're having an acute flare. So, and then there are times often when their symptoms are quiet. So the symptoms can kind of ebb and flow, they can come and go. And again, these flares can range from mild to severe, depending on, who you are, what your symptoms are, etc. Now, I know this may sound confusing. You say, well, how am I supposed to know if I have lupus? Well, the point is, you're supposed to, I would hope that you would ask us to help. This is where your job, my hope for you as patients is to not necessarily try to diagnose yourself at home, because you'll drive yourself crazy doing that. And Dr. Google sometimes can be a little scary. Your job is to say, gosh, I've been noticing this symptom that's been a little unusual, a little strange. I don't know if it's anything or not. Bring it up to us. Let us as physicians and healthcare providers help you understand what your symptoms are and what they are not. That is the purpose of this video about lupus and so many others, okay? But awareness is key, because the other thing I also feel about lupus is sometimes it gets thrown under the rug, and especially with African-American women being really, really, really affected by this. It's near and dear to my heart. Sometimes this condition gets overlooked, gets ignored, and it can be very, very, very debilitating for patients. How do we diagnose this condition? Well, certainly there's a number of things that we do. History and physical exam is certainly important. Lab tests we use, biopsy results we use. There's a number of things we use to diagnose this condition. That is important. And please understand that while lupus is not, say, curable, we can help you live a happy and healthy life with medications that can help quiet and relieve symptoms. That is one of the most important things. Lifestyle changes, medications can help control your lupus. You may have to see different doctors, but the idea is to keep you healthy. So I say if that's what it takes, hey, it's A-okay. Guys, it's important for us to have an understanding for patients with lupus, or if you've been wondering about it, I hope this was very helpful. Remember, any signs or symptoms you have that you don't understand what they are, you have the right to know. You deserve that. Make sure you come and see us. Guys, I'm Dr. Jen Caudle. Thank you so much for watching this video. Please share it with others. If you have not subscribed to my channel, I invite you to do so and click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.